join?
Yeah.
Good evening, sir. Thank you so much for joining. Yeah, thank you. Yes, sir. So let's begin the session now that we have Dr. Thomas online. So first of all, very good evening, everyone. And today, and welcome to the first, live session of Neolacta. And the topic would be unlocking the, power of human milk in the preterm babies. Now we have Dr. Thomas, who's an eminent pediatrician and a consultant neonatologist. And a quick introduction about him that he's completed his MBBS in Government Medical College, Calicut, and he's done his MD Pediatrics and fellowship in neonatology in the prestigious institute, St. John's Medical College, Bangalore. And also he has good research papers under his name. And on the other hand, what also fascinated me is he's very active in the social media, and he has his own YouTube channel called as the Pediatrics, and the other one is Tom's Thomas. So, and another thing is, I was curiosity. What built in me is he's also the author of one of the book called Medi Varipadu. So that is in Malayalam. Sir, it would be just glad to know that a doctor is very active in presenting the scientific information to the general population and the parents. So thank you for that. And before we begin the topic, it would be great if you could give us a gist about your book, which went viral among many of us.
No, the book is nothing to do with the scientific part. It's actually small events which has happened in my life. It has actually come out 2 volumes. The first volume is basically the stories about the family and things like that, and the second one is more of college and professional life events. So in the professional life events, that has touched a few events which has happened in the OPD, in the hospital, and things like that, which may be connected. I mean, the patients may find it relatable. That's all. That's it. And the name is actually Medi Varipadu. It's a new word. It's actually not a word which is actually there. There is something called as Vedi Varipadu in Kerala, which is the fireworks which happens in the temples. So just added the medical part to the first part. So it is Medi Varipadu.
Okay. So I think this would be of very interest for many doctors. They can correlate with the incidents you have captured in the book. Yeah. Okay. So coming back to the topic of today, unlocking the power of human milk in the preterm babies. Now, knowing that the human milk is the apt nutrition and the optimal nutrition for babies, either it is preterm or the term. So, what is the difference you would say? Why is it so important knowing the growth and development, the differences in the preterm baby versus the term baby? Why is it so important in the preterm babies?
See, when we talk about the importance of breastfeeding, one thing we usually always tell is that breast milk is species specific. That is, human milk is tailor-made for human babies, and cow milk is tailor-made for calves, and similar way. The components, the fats, carbohydrates, proteins, minerals, water content, lipase, everything is different in different milk. So in olden days, when the mother had less milk, we used to, not we, our earlier generations used to give cow's milk as an alternative. That was the best alternative which was available. Now we have got a lot of options. The formula feeds came in a few years back, which is actually bovine based, but they have tweaked it a little bit to make it as similar as possible to the breast milk. But still, it's a long way to go. And now, actually, the Western world is moving away from formula feeds, and they are coming more towards breast milk. They are trying in what all possible way breastfeeding can be supported. And we are actually a bit stuck to the 20 years earlier situation there, because now we are more prone to, or we are more the tendency to give formula feeds is much higher now, especially when the grandparents are around, because they always find a reason to give formula feeds. So one thing which we have to understand is all formula feeds are bovine based, which is not say half as good as breast milk. But when there is no other alternative, we used to use that. Even currently, it's the same situation. But now we have got other options like we have got breast milk banking coming up, just like blood bank. So whenever possible, we always try to give human milk because it is species specific. And now coming to the preterm part, uh, not only it is species specific, but it's also baby specific. That is, a mother who has given birth to a term baby will be secreting a particular kind of milk, and a mother who has given birth to a preterm baby will be secreting a particular kind of milk, and they are different. The milk secreted by preterm mothers are actually richer in calories. They are higher in protein content, and it is in that way it is different from the term milk. So the preterm babies actually needs to be given the milk of their mother, so that the preterm milk, which is richer in nutrients, can be what do you say, given to the baby, and the baby can get the full benefits of getting preterm milk. So and when you are giving other formula feeds and things like that for a preterm baby, you are risking the baby to many other issues, which we'll be talking in the next few minutes.
Thanks, sir. Thank you for emphasizing that, human milk is like species specific, and this has to be critically taken care, especially the preterm baby as well. Now, sir, now understanding that the specificity, what makes human milk superior in terms of formula or the cow milk? Like, what would be the components which would stand out here?
See, as I mentioned earlier, the right proportion of, if you look at the nutrients, macronutrients available, fats, carbohydrates, proteins, minerals, water, lipase, all these things are in the right proportion in human milk, which is in the appropriate proportion for a human baby. And the only thing which is actually lacking in breast milk would be probably the not breast milk, the iron content in milk is slightly lesser, but whatever is available in the breast milk is easily absorbable. Whereas in animal milk, that is not in a very easily absorbable form. And because of that, the babies who are fed on cow's milk are more prone to get iron deficiency. And in most of the formulas, they actually fortify that. They, as I mentioned earlier, in formulas, they are trying to make it as close to breast milk as possible. And then there are many anti-infective properties which are there in breast milk, which is like lysozymes. Sorry.
Please take it.
Yeah. Hope I'm still audible.
Yes, you're audible, sir. Please go ahead.
Then we have got what do you say, lactoferrin and different components in breast milk which actually protects the baby from infections. A lot of anti-infective agents are there in secretory IgG. A lot of components are there in breast milk which actually are lacking in formula feeds.
Right. Thank you, sir. And also, like now you said, we have this protective properties in the human milk. So, if you could give us some insights, especially with respect to cow milk protein allergy, knowing that there is a factor which causes that beta-lactoglobulin, which is more in the cow milk compared to the human milk, and there is no beta-lactoglobulin. So, what are your thoughts on this?
Cow's milk protein allergy is a very common thing which we come across in the practice. When the baby is on more than when the baby is on cow's milk, now what we are seeing is when the mother is on cow's milk, that gets secreted through the breast milk and is affecting the baby in a very bad way. And they present with excessive crying, excessive flatulence, sometimes gaseous distension, and a lot of problems. That it's not majorly the weight gain which is affected, but the baby shows other signs of indigestion. So in that case, the problem is the cow's milk protein which is coming through the breast milk of the mother. In that, we advise the mothers to cut breast milk, I mean cow's milk the mother is consuming. So you can imagine when you are feeding the baby directly with cow's milk, how badly it can affect the baby. It's not a thing which affects all the babies. Some babies escape, but a small number can be affected really badly with cow's milk protein allergy.
Okay, that's good to know. So now I think it's a good idea or a message to the mothers like to understand the intake of the cow milk. So here and also on focus on more nutritious diet here to support the baby. So now that understanding the human milk is important, at what day, let's say a preterm is born, at what day you start giving the feeds for the preterm babies?
The preterm feeding is a very tricky thing because first thing, usually when a term baby is born, the baby is actively sucking. The baby is with the mother. So once the biggest stimulation for mother's lactation is baby sucking, and that happens in a term baby. And the baby sucks. The first 2 days it will be low quantity, which is colostrum, which is high in the anti-infective properties, which we mentioned earlier, the antibodies, IgA, anti-inflammatory factors, and a lot of things. And from third day, fourth day onwards, the lactation improves and they start getting higher quantities. Whereas when there is a preterm baby, the baby is in an ICU most of the time. The mother is visiting the baby if it's a cesarean. Especially the mother will be visiting on the second day, third day. So the main stimulation of the baby sucking on the breast is missing there. So that is a big challenge we face while handling preterm babies. The mother's lactation is not established until the mother comes, sees the baby, and the initial sight of the baby is a little bit scary for the mothers who are used to seeing big babies. This is a preterm baby, small baby, my baby, and all these things happen, and they have to go through that phase of accepting that the baby is small, and then after that tension settles down. From third day, fourth day onwards, the process starts, which usually starts in the first day for the other mothers. So the initial days of feeding for the baby is compromised just because the mother's milk is not available. The other option is to give formula milk, which is always risky for a preterm baby when you start directly with formula feed. And if it's a very small baby, you may not be able to start feeds at all. You may have to go with IV fluids and something called as total parenteral nutrition, where you're giving all these proteins and lipids through IV line, and then starting at a slow pace in babies. It's something called as trophic feeding. We start at less than 10, not less than 10 ml per kg we start. And if it's a 1 kg, 1.2 kg baby will be given 1 ml every 2 hours. That is not for the nutrition part. That's to prime the gut of the baby with milk, and they know that there is something called as milk coming. The digestion part, the digestive juices are secreted because the baby has been inside the uterus swallowing a lot of amniotic fluid and things like that, and then when the baby comes out, the whole process comes to a stop. The baby is starving. So just to avoid deprivation of the gut, we give 10 ml per kg. Again, it's not for the nutrition part, it's just to prime the gut. And the rest of the nutrition you're giving through IV line. And then gradually, when the baby starts tolerating feeds, if the baby is active, you start tube feeding. That is, you increase the quantity of feeds you are giving little by little. Say, usually a term baby, after the initial 2-3 days, will be taking around 100 to 150 ml per kg, and they gradually go up to 150 to 180 ml per kg, depending on how well the mother is lactating. That is actually the quantity the baby requires. So initially, the preterm baby will be given 10 ml. That is almost 1 by 20th of what 1 by 15th of what the baby actually requires, and then you gradually increase 20 ml to 30 ml per kg per day. And you, if the baby tolerates well, then by the end of first week, by 7 to 10 days, you will be able to remove the IV line, and you will be able to completely switch over to feeds alone. Now, the baby on IV fluid, why you start feeds early is one question. Because the baby has got all these risks. The baby, small baby, can have indigestion, and in worst cases, it can cause decaying of the intestine, which is called as necrotizing enterocolitis. And all these risks are there when the baby is started on feeds. In spite of all that, we push to start feeds and increase as early as possible because of various reasons. One, the more you delay the feeds, the more chances of the baby having feed intolerance when you start feeding. As long as the baby is on parenteral nutrition, we will be having a central line. So the risk of getting infections are much higher when the baby is on TPN. So you want the baby to come out of all central lines and all the extra tubes which are inside into the baby to be taken off as early as possible. So you start the feeds early, progress as early as possible, depending on the baby's condition, so that the nutrition part is more balanced when the baby is on feeds, and the risk of infections are much lesser when the baby is on feeds. So earlier, the feeding part used to be a little more slow and steady. Now, most of the places, the feeding is more aggressive. You try to start at least trophic feeding right from day one, and you try to progress as quickly as possible because of various factors, including the risk, reducing the risk of infections.
Yes, thank you so for emphasizing. I think this is a message for the mother, because even the mother also has to put an effort to express the breast milk so that she can provide the preterm, with the optimal nutrition. Now, let's say, sir, now knowing the benefits here, now when the mother's milk is not available, yes, please go ahead. Please go ahead.
Emergency അല്ലെങ്കിൽ കുറച്ച് കഴിഞ്ഞിട്ട് വിളിക്കാം, ഞാൻ ക്ലാസ്സിലാണ്. Yeah, sorry.
Yeah, sure. No problem, sir. So knowing that, sir, if the mother is able to express the breast milk, then it's well and good. Now, there are many situations which is unavoidable. Then how do you handle such situation, making sure that the baby gets the human milk?
Yeah. So as I mentioned earlier, the mothers initially will be under immense stress, and more often than not, you are unable to get mother's milk for a preterm baby during the initial 3 to 5 days. We always tell them to start expressing on day one itself. They are given a breast pump. The process is started on day one, but usually the quantity of milk we get will be negligible. But even that one drop, we encourage the mother so that that improves her mindset, and the lactation gradually improves. But most of the time what happens is we are forced to go ahead with an alternative option. So in that case, we had earlier we used to go with formula feeds, and that also in some centers what they do is the preterm formula is actually loaded more with protein and the rest of the things, because the requirement for preterm babies are higher. But the problem is the gut may not be able to tolerate it. So in some centers what they do is initially they start with term formula, and once the baby is stable, they switch over to preterm formula, because the initial time, as we mentioned, it's not the nutrition we are actually worried about. We are just trying to prime the gut. So for priming the gut, the trophic feeds early days, they start with term formula and then switch over to preterm formula. We also used to do that, but now what we are doing is we are exploring the option of having human milk banking. So we try to get human milk and we try to give that. But again, being a preterm baby, we don't have the option of choosing the preterm milk. So the priming part is taken care of by the human milk which is available, and we push the mothers to start expressing early, and as early as possible we start mother's milk, so that the baby gets the advantage of preterm milk, and until the 5th day the baby is not deprived of having the advantage of preterm milk, because we are starting at least some human milk and priming the gut, and then whenever the option is available, we are switching over to the mother's milk.
So, okay, now you said that the formula definitely has some risk, because it's not designed for the preterm babies, and even if it is designed, there is definitely some damage happening. with respect to the absorption and others. Now, looking into that perspective, let's say mother's milk is not there, then donor's milk would be beneficial, right, in priming the gut and making sure the feed is continue. So, what are your thoughts on that?
Yeah. Uh, Say 5 to 10 years back,
Hmm.
when this donor milk, we started talking about donor milk here, there was a uh, resistance by the mothers and some parents, some grandparents. The acceptance was not that great because the notion that the baby will be attached to the uh, milk, when say the milk provider, that is the whole idea of having, I mean, considering cow as a mother and things like that. So giving another mother's milk was unthinkable for many of the parents. So we had to spend a lot of time counseling them regarding these options and the importance of giving human milk itself and things like that. Now in Kerala, we have got two milk banks, one at Ernakulam, one at Thrissur. In Ernakulam, we are having it at General Hospital, and Thrissur it's at Jubilee Mission, and more centers are coming up. So what the news of these milk banks have done is it has created awareness in people that there is something called as milk banking. So earlier, when there was blood bank set up, there was resistance from people. People were scared to give blood. They were scared to receive blood. They didn't know what is happening. So once the blood banks have been established in a big way, now we have got all the what do you say, social activities starting off or ending with a blood donation camp. So there is something like that which is happening in human milk banking too. The inhibitions are going off. People are more aware of these things. But again, the storage and things like that has to be with utmost care. And because of that, the system here in General Hospital Ernakulam, they are receiving the milk from mothers who are delivered there because they are sure about the screening which has happened and things like that. They have to come to the hospital, pump, store, and they have got the whole process of doing it. So to ensure the screening part and all these things, they have to put a lot of effort. And being a government setup, they have got inhibitions, they have got shortage of staff and fund and everything like that. But still, it's running in a good way. So it is impossible to supply the whole state. Forget the state because there are only two centers now. So there are a lot of places who require this milk banking setup. It is impossible to supply the whole district also. So it is there, but it is not enough to supply even a district. So we need more milk banks coming up. At some point, it may happen. So now we have got other options like Neolacta, where there is human milk banking, and they are ensuring the process. And I think I've been using that for last 3 to 5 years now. Once I was convinced about the process and the rest of the things, the screening of mothers which is happening, the processing of milk which is happening, the storage and all these things. Once I got convinced, I've been using that in my NICU for this as the trophic phase until the mother takes over the lactation part. I've been using it for quite some time and quite happy because earlier when we were using formula, I don't have a study to state how many percentage the PVL or anything, but practically we have been feeling that the tolerance of human milk is much better when compared to formula milk when so preterm babies are fed on that.
Yeah. Thanks, sir. So it's very important, and I'm so unfortunate, even there are some people who think that using donor milk is a taboo, but it is not. It's actually benefiting the baby. And it's also very important about the quality of the human milk we receive. So here we ensure that, we test, there is a pre and post quality testing, and we ensure that the product is reached in the right manner with the proper quality. So if this practice is continued in the vast milk bank, then I think many babies and the mothers, both of them will be benefited with this. So thank you for this message. Now coming back to the human milk in the preterm, now they say what, like, the human, like the mother's milk alone is not sufficient to meet the needs of the preterm baby, because the preterm baby, like, like you mentioned in the beginning, the protein quantity is more in the preterm milk compared to the term. But in case of need, when we give a term milk, then the baby would be lacking. So what are your thoughts on importance of fortification of human milk?
Yeah, that's where this human milk fortifiers and all these things come into picture. So there will be once the first 2 weeks the baby is covered, once the initial problems are settled, then we start targeting at the weight of the baby. So we want the baby to gain weight in a proper manner. The graph is maintained and things like that. So at times we are forced to go for milk fortifiers. That is, you add something to the milk and make it more richer in all the nutrients. Uh, there are different ways of pumping in more calories and proteins to the baby. One of them, which we usually try, is to increase the quantity of milk the baby is taking. The preterm babies can tolerate up to 200 ml per kg. Term babies, usually it's around 150 to 160 ml. And once the baby, the preterm baby, they start tolerating feeds, we relax the fixed quantities and we give if the baby is tolerating more milk. So if the babies are taking up to 180 to 200 ml per kg, sometimes the baby may achieve the desired weight in that. In some babies we may not be able to increase the quantity of milk so much. In that case, we may have to make it energy dense, whatever quantity we are giving. So we have had this human milk fortifiers for a long time, but they were from bovine source. So bovine sourced fortifier is used in used to fortify the human milk, which the breast milk which we are giving to the baby. But now we are, I think, Neolacto itself has come up with human milk fortifiers, which can be added to human milk. Just a minute, please.
Yes, please.
Hello. 7 മണിക്ക് ശേഷം വിളിക്കൂ കേട്ടോ. 7 മണിക്കല്ല, 8 മണിക്ക് ശേഷം വിളിക്കൂ കേട്ടോ. ഒരു ക്ലാസ്സിലാണ്. Sorry, that's the emergency phone from the hospital, so I cannot keep it in silent mode.
Yeah, absolutely. I respect. No worries, sir. Yeah, please go.
So now we have got the milk fortifier, which is sourced from human milk. So it is definitely a safer option. So in that case, like if at all a need arises where you are forced to fortify milk for achieving the targeted growth in babies, you've got option of having a fortifier which is sourced from human milk itself, which is much more safer option.
Yes, thank you, sir. So here, because when it is very important, like we maintain exclusive breastfeeding in the first 6 months. Now imagine a preterm baby. When we are giving mixed feed, we are missing the concept of exclusiveness. So that is where we are ensuring you give human milk and you also fortify with the human-based fortifiers when in need, as you mentioned. So this could cover the exclusive, breast milk feeding in the preterms. And it has beneficials because human milk itself is beneficial. So it could be beneficial. And so, like, could you also share some experiences while, hug feeding the preterm baby? Any challenges? How did you overcome? Was there any requirement of fortification? How did it help? So this will help the audience to understand.
More than one-to-one case discussion, as I mentioned earlier. In our center, we used to go with formula feeds initially. Even for preterm babies, we were forced to because the mother's milk was not there. This was 10 to 12 years earlier. We used to start with formula and then later switch over to mother's milk. But during that initial first week, there were more of feed intolerance in preterm, so we had to stop it and then restart. Sometimes when we had 2-3 bad cases, we used to hold the feeds until when the next case comes. We are obviously more defensive when you have faced a problem in the earlier babies. So we used to be defensive. We used to wait till the 5th day, 6th day until the mother's milk starts coming, and then we used to start that milk to be on the safer side. But now for the last 2-3 years, I've been using human milk. And once that is there, on the first day itself, we are confident of starting trophic feeds. We have hardly faced any feed intolerance, and we are aggressively moving in the feeding part. So by the 4th day, 5th day, by the time the mother has started lactating, the baby has already reached around 60, 80 ml of feeds per kg per day, 60 ml to 80 ml per kg per day. So once the mother starts lactating, not a drop is wasted. We can directly go ahead with the quantity whatever the mother is giving us. So as I usually tell my mother, like here there is this norm that until a mother is a lady is delivered, she is not complete, because motherhood is what completes womanhood. And until you actually lactate and feed the baby, you cannot complete your motherhood as well. So actually all these things are actually to improve the breastfeeding part and to motivate mothers. But at times what happens is it demoralizes certain mothers who are unable to lactate. And I've never thought of that during my academic time and the initial years of practice. And we had mothers breaking down because they felt very guilty because they couldn't lactate and things like that. So now what I'm telling them is, you always have the best option, and the best option is not available. You always look for the best possible option. So if the mother cannot lactate, or initial days when the milk is less, that it can happen physiologically. So in those cases, you have to choose the other option. So the next best option is human milk banking. And currently, one problem that the human milk banking is facing is, one is the lack of things. And whenever there's a lack of thing, then obviously the cost will be higher. So many parents are not able to afford it. But during the initial 1 or 2 weeks, if you actually work out the economics, if the baby is off TPN, off NICU, earlier discharge, there is no harm in spending money on human milk in the initial days until the mother's lactation is established. So obviously it can reduce the hospital stay by a week or 2 if the baby is on the baby is tolerating feeds and the baby is aggressively put on feeds and it is increased in a very quick manner.
Yes. Yeah. Thank you, sir. So you're saying that it's very important to start the human milk so that we can prevent many of the complications or adverse events and reduce the cost, overall cost.
Like infection chances, NEC, and different things are there. Baby on ventilator. All these things, definitely the risk can be reduced if the baby is on milk, baby is on feed. So if the mother's milk is available, always go for it. If the mother's milk is not available, go for human milk. If that is also not available, then you go for the next option. So always choose the best available option whenever possible.
Right. Yes, sir. So also, like, sir, now with the best available option, I think it's also important, like, the mother milk provides the healthy bacteria compared to the other sources. So what are your thoughts on this?
Yeah. Now, if you look at the formula feeds, the premium ones, it will be written now with probiotics and things like that. Probiotics and basically you are trying to give the baby's gut a proper bacterial system, which is actually attained only from the human milk. The flora which is developed from cow's milk is totally different. From formula milk is totally different. So if you are able to give mother's milk, that is the best thing which can provide a proper bacterial flora in the baby's gut. And even that is different when the baby is born through vaginal delivery and cesarean delivery. So it's such a delicate thing. So it is always, again, when you have the best available option, you choose it. So if you can give human milk and develop a proper bacterial flora in the baby's gut, there's nothing like it. It helps in a lot of things, including the neurodevelopmental outcome, the consistency of stools, all these things are much better when the baby is on exclusive human milk.
Right. So when we say when healthy bacteria, like in adults, even the preterm baby, you give the human milk. We are giving the healthy bacteria right from the start, which is needed for them. So rather than supplementing with the source. So this is something the mothers have to understand and also make sure that they express the breast milk and give it to the baby. So you are supporting in everything. And also, sir, like with respect to now, initially we mentioned the immunoglobulins, the importance of the colostrum. And what are your thoughts on the human milk oligosaccharides, which is very rich in, human milk compared to the other formulations? So, and this is a natural source. So, what do you say with that?
Now, and then as I mentioned about the prebiotics, probiotics, that is something else which is now coming up in formulas, GOS and FOS. It is the latest edition in last HMOs in last maybe 2 years. For all these years, we have been giving formula which lacked all these components which are freely available in the breast milk. More than telling the mothers, it is more difficult to convince the grandmothers because the image of babies which has been which have been put into the heads of Indian parents is the one of the round ones who can hardly sit, who falls, and so when the baby, even if the baby is of normal age, the mothers are not satisfied, the grandparents are not satisfied. An auntie who's visiting after so long, they come and tell, how old is the baby? Baby 6 months. Oh, baby looks 3 months old. So that one dialogue can actually crash the mother's confidence. There's nothing wrong with the baby. It's all the mindset because we are used to those images of round babies in our mind. Health and weight is totally different. So to have healthy babies, the baby should have all the nutrients in the right proportion. And that is the best available in human milk. So that is the way you should look at it. And it's not always targeting the babies because invariably the most common complaint any pediatrician faces, at least in India, is lack of appetite, lack of weight of the baby, not big enough. So more than that, we should be targeting at healthy lifestyles. So the most important part is to give exclusive breastfeeding till 6 months, and then when you start cultivating food, more than concentrating on the quantity of food you are giving, should be concentrating on the quality, the mixture of food. You give cereals, pulses, vegetables. You are including all the components in the food. That is which is more important. But here we are so obsessed with the quantity. You just try to pump in food right from the beginning, from day one. You try to find a reason to give formula feed. The baby is crying. The baby's tummy is not looking full. The baby is not weighing when you lift the baby. You find all sorts of funny reasons. The baby is not as big as the baby who was delivered in the next house. At least there are 10 to 20 excuses. You cut it one by one. The baby is not heavy enough. You tell them the baby's weight is this, and then they tell the next complaint that the baby is not sleeping at night. Usually, the activity of babies is such that the daytime they sleep and night they are more active. They feed more at night because the lactation hormones are happening, secreted more at night. So for the same effort, they put more milk is secreted at night. So once you tell them that reason, then they come up with another excuse. The baby's tummy is not full. They find different reasons to somehow give formula. So that is something which I think that there should be a cultural change or a massive educational campaign which should happen, that it's not the weight we are targeting, it's the health of the baby we are targeting. And there's nothing like human milk which can take care of the baby's health until 6 months of age.
Yeah, so you rightly said it. So because when you were saying that it's basically the grandmothers and the mothers, I could connect to it. So whatever
I
it
think
may
most of
be,
the
it's just,
mothers will be connecting to it.
yeah, yeah, I was just smiling with this thought. Is like, yes, I have faced it. The baby is not gained so much. It doesn't look that heavy. It's lost the weight. Keep feeding, give that, give this. And yeah, this is right. I think the mother should educate. Yes, sir, please
That,
go ahead. You're saying
no,
something.
no, that's one thing which we have. I've changed in my practice in last few years. So initially we used to concentrate on the mother, counseling the mother, and things like that. Now for the first follow up, we ask the grandparents to come. and the husband to come, because unless you convince them, you can never implement the thing. You can convince the mother, but the implementation part comes from other higher authorities. So you have to convince them to make this practical.
Yes, totally agree to it, sir. It comes from the higher authority. Initial counseling would be help. I think I can also connect if we start that. There could be a, improved acceptance in different, human milk or donor milk or anything maybe, or even it comes to donation, it can change the overall idea and acceptance. So now at the end, like, now we have a preterm baby. How would you suggest, like, to continue the human milk from the term and the later on, like months of life?
Okay. The first and foremost thing, which has been told at least 3 times today now itself, the biggest stimulation to continue lactation is the baby sucking the breast. So continue feeding, and it is demand feeding. So if it's a preterm baby, initial days we tell them to feed every 2 hours, 3 hours. You keep a timetable, you feed the baby. Once the baby has gained adequate weight, the baby has crossed say 3 kg and all, then the baby can decide when to feed. So then it becomes demand feeding. If the baby is feeding more frequently at night, be prepared, feed more at night. If the baby is taking a break during daytime for a longer period, you can do that. And continue breastfeeding, demand feeding, as long as the baby is taking. So the recommendation is exclusive breastfeeding till 6 months of age, and then you start the other foods. You continue breastfeeding along with that, and continue breastfeeding at least till 2 years of age. And sometimes working mothers, or in some cases when the mothers are studying, they are appearing for exams and things like that, you may be forced to look at other options. So even then, one thing you have to understand it, the best option still is breast milk. You can always express and keep breast milk. So it is, if at all, even if it's for a day you are going to be separated or you're going to be away from the baby, it's always good to invest in breast pump, because a tin of formula premium ones will cost you around 1,000 rupees. A breast pump, a manual one, will cost you around 2,000, 3,000, the good quality one. So in the long run, it is definitely going to be beneficial. So what you do is, even this can be started in the initial day, which is again I had mentioned just a minute ago. For preterm babies, we start using breast pump, because that helps in increasing the lactation. Because when the baby is not directly sucking, again the rule of best available option, when the baby is not able to directly suck, start using breast pump. The breast milk can be stored in room temperature for 4 to 6 hours without any problem. So if you are, say, going to the office in the morning, you are able to come back at noon, one feed can always be expressed in the morning, and that can be given. If you are able to express one day prior at night, you can easily store 1 or 2 feeds, for 2 or 3 feeds for the baby for the next day. The only thing is you cannot directly heat it or directly use the microwave oven to heat the milk. You have to thaw it. You have to heat water in another container, place this milk inside that in another container, and give that milk which is of normal temperature. Store it properly in a proper glass container or a steel container. Don't avoid using plastic containers, because the fat will get more stuck to the surrounding with the plastic container. So direct feeding plus express breast milk can run the show until 6 months of age. And after that, if you are giving other food, some mothers actually are so convinced about the benefits of breast milk that when they are switching over, when you're starting complementary feeds, they dilute the complementary feed in breast milk if they are lactating quite well. So that kind of dedicated mothers also we are seeing. So as long as possible, you can continue breastfeeding. There is no upper limit for breastfeeding, but you should be continuing it until at least 2 years of age. So breastfeeding directly with the breast pump can take care of a lot of things.
Yes. Yes, sir. So it is very important to continue the breastfeeding either by pumping express breast milk or direct feeding. Sir, and now that we spoke about, here, like, just a thought just popped up in my mind, grandparents and mother. Every mother would want their child to have their improved IQ, The So now we said the human milk definitely helps in neurodevelopment. What would you say about that? It's very
There are
important here.
there are studies which prove that the IQ levels are better in babies who have been exclusively breastfed till 6 months of age, and the breastfeeding has been continued till 2 years. The IQ test done at 5 years, 10 years, and all showed better results when the baby was on exclusive breastfeeding. So it is a scientifically proven fact. It's not what we just what do you say tell in MBBS classes. Our professors used to tell that is exclusively in MBBS terms. If you are exclusively breastfed, you will be probably able to crack the entrance. And if you are breastfed till 2 years, then you will be probably able to crack the PG entrance as well easily.
That's right. Correct. I agree with you. So, and now that in the preterm, so it is definitely right. If we start the exclusive feeding in the preterm baby, and it's a long term, it will help them in the neurodevelopment and IQ. So it's a news for the mothers, just a message for the mothers that please ensure that you give the mother's milk or human milk in your preterm baby so that they get the appropriate nutrition and also support the neurodevelopment. So, and not and at last but not the least, sir, what would be your key message to the mothers and the general population about the importance of human milk in a preterm baby?
And put in a simple way, when you are thinking of formula feeds, always think of it as a medicine. There has to be a proper indication before starting formula feeds. So you have to go to the hospital, check the weight, speak to the doctor before deciding to give anything else other than your milk. And breast milk is so important. It is as important as blood. Just as you are seeing blood banks around, you'll be seeing more and more breast milk banks around. So convince yourself and others to express and give to your baby, and if possible to the other babies as well. I know it's not easy because as I mentioned earlier, the collection centers actually insist on them going there and collecting to ensure the cleanliness and things like that. You cannot pump at home and give it because they cannot ensure how good it is. So it is a taxing process. So it's not an easy job, but at least you can do it for your baby. So use breast pump, get maximum benefits of breast milk, and pass it on to the next generation.
Yes. Thank you. Thank you so much for the key message, sir. And also want to let you know that your, mothers have just messaged that it's an insightful session. So I'm sure many of the mothers will be benefited from this blog. Thank you so much for giving this insight. It was a great session, engaging you. And thank you. Look forward to working with you later. Thank you so much, sir.
Thank you.
Have a great day. Thank you. Bye. So thank you everyone for joining the live session. I'm sure you have gathered good insights about this session and have a great day.